Hi everybody, welcome to my channel Magic with Food for the next episode on diabetes. Now in this episode we are going to discuss on diabetes, how well it is dealt by Ayurvedic doctors. We have Dr. Videhi on the show explaining about the various doshas and the Chikitsa for diabetes.
Om Dhanvantare Namaha. Hello everyone. Today I am here to speak about the management of diabetes or Madhumeha the Ayurvedic way in simple words. Diabetes is a chronic lifestyle disorder and metabolic disease condition involving the disorder of carbohydrate metabolism. The clinical conditions of this is similar to that of Madhumeha described in Ayurveda under Prameha Roga. The body is made up of 3 doshas, Vata, Pitta and Kapha, and 7 dhatus, Rasa, Rakta, Mamsa, Meda, Asthi, Majja and Ojas. These are in turn made up of Panchamahabhutas. Imbalance in doshas leads to imbalance in dhatus, leading to diseased condition of the body. Sometimes Pitta may get vitiated or get imbalanced, sometimes Kapha, sometimes Vata, and accordingly the disease condition or the clinical manifestations will appear. When they are doing their prakrita karma, that is normal work, then everything is fine. But when their imbalance occurs, then one or the other conditions appear in the body. Why this is happening? This is happening because there is imbalance in the Agni. That is, there is an imbalance in the gut health. This Agni is nothing but Jataragni, or also called as Kayagni. Whenever there will be an imbalance in Agni because of Mithya Ahara Vihara Palana, that is improper diet and lifestyle, there will be a formation of toxic material known as Ama. This toxic material, Ama, creates Sroto Avarodha, leading to imbalance in dosha. The same thing is true with diabetes or Madhumeha. Here, initially, Kapha is a Pradhana dosha, Rasa and Medas are the Pradhana dhatus. Later, as the disease condition progresses, there will be involvement of other doshas, Vata and Pitta, and also other dhatus, which makes the disease complicated. When this stage is reached, the disease becomes Kashtasadhya or Asadhya. So that is what we say in modern science. If you are pre-diabetic or borderline diabetic, then with few changes in your lifestyle and diet, you can avoid reaching into that disease condition. But if you are diabetic, if you are already diagnosed with a diabetes, then also possibilities of improvement if you concentrate on some of your lifestyle and diet systems. Apart from the medicines, these play an important role. That is what has been stressed in Ayurveda too. Today I am going to discuss more about these things rather than the Chikitsa. So as I told, Kapha is a Pradhana dosha and Rasa and Meda are the Pradhana dhatus here. The dushti happens or the imbalance happens in these doshas because of imbalance in the Agni, the production of the Ama, leading to Srota Avarodha and leading to the disease condition Madhumeha or diabetes. We can list some reasons here why this Agni is getting imbalanced. We can have some reasons for this. So let me give a list of these things and let us discuss along with that. Adhyashana is one among them. That is nothing but ingesting food when the previously ingested food hasn't been digested yet. Like some persons will have this eating disorder. They keep on eating. They will not even think about the portions or whether it is needed for them. Sometimes stress is also one of the reasons for this behavior, which definitely leads to obesity. Second one is excessive intake of madhura, amla, lavana rasa, ahara. Third one is excessive intake of navanna, that is new grains, guda vikara, that is jaggery based food items, jaggery or sugar based food items, dadhi or curd, red meat, high calorie diet and processed food. Diva swapna or day sleep, avyayama, lack of exercise, ayasa, ati sukha, that is taking all the time relaxing, not doing anything, not thinking about anything, just staying calm more than required. Foodie, alasya, that is laziness, etc. are the reasons for the onset of the disease. Another one is bija doshaja, that is there will be some genetic disorder. Because of that, this madhumeha or diabetes comes to the human beings. That will be some problem in chromosomal level or the genetic level, that's what we call it as. That is nothing but bija doshaja. So Ayurveda treats madhumeha in 4 different ways. Basically, we can divide that thing into 4 ways as aharaja, viharaja, yoga and meditation, chikitsa. This is the holistic approach. Whenever this is followed by patients, the life becomes more simpler and beautiful. The dependency on the medications will be lessened. The complications will be lessened. So let me talk about aharaja. Aharaja is nothing but the food that we are taking has to be taken care. When we take the food which is not good for our body, then it leads to imbalance. So what we have to do in madhumeha or diabetes? Nidana parivarjana. So previously I mentioned about the causative factors. So that has to be left or taken care. Nidana parivarjana. You need to avoid the causative factors like eating sweets, high calorie diet, consumption of alcohol, untimely eating of food, etc. People who are diagnosed with diabetes or those who are pre-diabetic or borderline diabetic can have these foods in their chart or in their preferences as their preferences. Red rice, brown rice, barley, green gram, wheat, sattu, it is nothing but chickpea flour, horse gram, basin flour along with green leafy vegetables and all sorts of gourds like bottle gourd, ash gourd, cucumber, beans, all these can be taken as their primary food. They can also take the gooseberries or amla as a rasayana dravya, the one which gives benefits to the body. And also they can also go for the preparations like kanji, which will also give them a benefit. This kanji is nothing but a kind of a resistance starch or a fermented product which is very beneficial in diabetes. Even you can include the spices like turmeric, cinnamon, pepper, ginger, fenugreek, dhania, more. These can be used in different forms. The kashaya can be made out of these and can be used. Fenugreek at least can be soaked in the night and the next morning you can have the water of it. These are the simpler methods, and even while having the food you can have the fenugreek water, that is also very much advisable, and the jeera water, that is also very much advisable. Dhania you can use, cinnamon you can use, turmeric day-to-day cooking we can use. So these will definitely help in diabetes. Apart from that, even one can have lean meat instead of red meat. Lean meat is high protein, rich in protein, so you can use it. Meat broths are also better for those who are consuming it. the combination of the food is must here. Like, do not keep on taking the rice. The rice should also be added with the green gram or the pulses, rather, I can say that, or the wheat. When instead of taking simple rotis, you can add sattu or besan flour in it and then make rotis. What happens by doing so, or eating of the vegetables, adding of the vegetables to our diet? The digestion process will be delayed, and this helps in controlling the sugar spikes. That's most important. Apart from that, even in Ayurveda, they have told the eating pattern, how one should eat. One should have the mindful eating rather than the plateful eating. Timely eating is a must. Try to follow the circadian rhythm, which is very beneficial. Get up with the sun, sleep with the sun. If you are able to make it, it's really well and good. Otherwise, try to bring smaller changes in your eating pattern. Do not do feasting or fasting. Hita bhuk, mita bhuk is always a mantra in Ayurveda. Eat which is good for you. Eat which is necessity for you. Hita bhuk, the diet which is good for you. Mita bhuk, have the control over this eating. Some things you need to avoid because health demands that. I know no one is ready to take the bitter gourd. Everyone hates it. No one is ready to take the fenugreek, but it helps in the condition like Madhumeha in controlling sugars. So that should be our focus. And the choice of the food must be according to Desha, Kala and Rutumana. See how beautifully they have explained it. A person who is staying in South India, rice, ragi or jowar may be his chief food. The person who is staying in north part of India, the wheat may be the main food. So have the right choice according to your desha, the way you are living. And kala, like seasonal changes, the timing. If the rutumana, if the winter is there, then have the warm food. If the summer is there, have the normal temperatured food, not the cold, not too hot. It should be a normal one. Then your body will have prakrita doshas. That is what has been told in Ayurveda. Now let us go to Viharaja. Sedentary lifestyle should be avoided totally. Activities just be increased throughout the day. One can follow, again I am telling, the circadian rhythm here. Early to bed, early to rise must be the mantra. Chakramana, yogasana are also necessary. In Ayurveda, they beautifully tell a Madhumehi rogi should construct a well. What does it mean, constructing a well? He should only construct the well. He should not take the aid of anyone. What does it mean? Can he go and dig the land and construct a well? So we know this usually diabetes, it is more seen in adhyarogi, sedentary life people, or obesity, those who are having obesity. This is seen more in it. So you need to do that much of shrama. You need to use that much of energy so that the complications can be avoided. So this is all about Viharaja. Now we'll come to yoga and meditation. Ayurveda not only treats the body, it also treats the mind. Stress is one of the chief causative factor for this diabetes or Madhumeha. For that, you need meditation as medicine. Yoga is for body. When you are doing a Surya Namaskara, when you are doing different asanas, which are beneficial in this, the body muscles get tuned, get strengthened. And when you are doing meditation, your mind becomes calm. The tamo guna, which is more in Madhumehi rogis, will be reduced. The laziness, the lethargy, the ignorance, these are the characteristics of tamo guna, which is seen in most of the Madhumehi rogis. They are not active. They don't want to go. They don't want to work. They don't want to read. They don't want to say anything. Lethargy will be there in their body. So that is because of the tamo guna vartana. They always want to sleep. In the morning also they want to sleep. Night, at least, it is a normal thing. But in the morning, in the afternoon also, soon after the food, before food, they want to sleep. They don't want to work. So by doing meditation, there will be a control over the tamoguna, and it has a soothing effect on the body and the mind. Last one, which is a Chikitsa. In the initial stage or also during the diabetic ongoing process, you can follow all these things. You need to follow Aharaja, Viharaja, Yoga and meditation. These are must. Apart from this, there are some Chikitsas in Ayurveda. Ayurveda has lot of medications like Rasaushadhis, Kashtaushadhis and Panchakarma therapies to treat Madhumeha. But one thing I would like to tell, Under a qualified Ayurvedic physician, one can get treated. Do not go for the self-medication. That is must. Panchakarma therapies also helps in the detoxification of the doshas, but it should be done under the supervision of Ayurvedic physician, and his advice is must. This is all that I want to tell about the treatment aspects of Madhumeha in Ayurveda. These all have been written in different samhitas by Charaka, Sushruta, and different scholars. Try to follow these simpler things in your day-to-day life. They will definitely give you a better beneficiary results. Do not be afraid of diabetes or Madhumeha. Do not take stress. Try and follow these simpler methods. You need to live something to get something good rather to say. So again I say, Hitabhuk, Mitabhuk should be your mantra. Namaskara.
We have different Ayurvedic foods which help to control diabetes. For example, we have fenugreek seeds. It slows down digestion, checks blood sugar, improves insulin activity. These seeds contain fiber that help in slowing down the digestion process and regulating absorption of carbohydrate and sugar. Mix 1 teaspoon of fenugreek powder with lukewarm water and drink in early morning every day. 10 milligrams of fenugreek is recommended daily. Gourd or Karela is known to regulate blood sugar levels and treat diabetes. It can be taken in the form of juice or it can be cooked and taken. Amla, it can help to regulate blood sugar levels and also make the body more responsive to insulin. Eat it fresh or prepare juice. Horse gram, black Bengal gram or sattu, barley are best for diabetic according to Ayurveda. It helps in controlling the blood sugar. It can be cooked or it can be added to wheat flour and made into chapatis. Barley can be cooked and the water can be taken. Red rice is better than the white rice. Old rice is better than the new rice. Red rice slowly gets digested and then releases the glucose. White rice spikes the blood sugar levels. Hence, red rice and old rice or matured rice is always good for diabetes.
Spices. There are many spices that have shown anti-diabetic properties. Cinnamon, mustard, coriander and asafoetida can be used in meals, drinks which help to manage diabetes naturally. Hemp seeds, aloe vera have also been found effective in managing and controlling diabetes. Ginger tea helps to stimulate digestion, which is very beneficial in reducing the excess kapha in the system. Jamun, also known as Indian blackberry, it is a top food in treating diabetes. It contains jambolin, which helps to slow down the diastatic conversion of starch into sugars. How to use it? It can be taken as a fruit itself, otherwise, the juices or tablets are available in the market. Turmeric, an Ayurvedic superfood. Curcumin, An active compound found in turmeric may decrease the levels of glucose in the blood and also address other diabetes related complications. How to use? It can be added to various dishes during preparation, or a glass full of turmeric milk can be taken.